And what about people with dementia who have depression? Can we effectively treat depression among people living with dementia? And the answer is yes. I'm Dr. Regina Koepp. I'm a board certified clinical psychologist and geropsychologist, and I founded the Center for Mental Health and Aging so that you have all the tools that you need to meet the mental health needs of older adults. When it comes to dementia, more than 95% of people experience neuropsychiatric symptoms like apathy and anxiety and agitation, so on. Apathy being one of the earliest symptoms of dementia as it relates to neuropsychiatric symptoms, meaning mental health expressions of a brain disease like a dementia disorder. And so depression actually is also seen as both an early sign of dementia as well as a risk factor for dementia. And so it becomes very difficult to tease these apart. But what we do know is that when we treat depression, even in the context of a dementia disorder, that this helps the person as well. Let's talk about how. One is it eases suffering. Two is especially if we're able to identify dementia early in the disease course, we can help the person implement some scaffolding to help them live a full, meaningful, independent life for as long as possible. We can help to connect them to communities of other people living with dementia disorders, like with Dementia Alliance International. A few years ago, I did an interview with Chrissy Thelker, who is a woman living in Canada who has a diagnosis of dementia, and she came on talking about her experiences with a dementia disorder. I'll link to that interview below. But she talks about how powerful the community she has with Dementia Alliance International, which is an international group of individuals with dementia who created this organization. So it's founded by people with dementia, for people with dementia, run by people with dementia. And so it's profound and collective and provides a community for people who experience a lot of social isolation because of lost relationships. And so Chrissy Thelker, in the interview that I did with her, talks about this experience. But so we can help connect people to community. We can help connect people to psychiatry and neurology to help manage some of the neuropsychiatric symptoms that can come with dementia so that they experience less suffering and maybe build a better quality of life. We can also provide support and resources and therapy to caregivers, to family members who are coming to terms with understanding how to constantly calibrate their approach with their loved one living with dementia so that they don't overstep when the person with dementia can still maintain things independently, and don't understep when the person with dementia needs more supports in place. And so there's a lot that we can do. Even our clinical assessment tools for depression can be modified for people with dementia. So for example, I use a Geriatric Depression Scale 15 often with people with mild cognitive impairment and earlier stages of dementia disorders. And then there are other scales that you can use to identify depression where there's more of a caregiver interview with caregiver observations, especially when the person is not as able to participate in psychotherapy or psychological assessments to better understand their symptoms. And so there is a lot that we can do to help people living with dementia manage their depression. And so when it comes to therapy, I hear many therapists say, a person has dementia, there's not much I can do with them if they have depression. And that's actually a false narrative. There is a lot that you can do to help the person with dementia or mild cognitive impairment manage depression and live a good life. Therapy can help reduce the person's distress, increase their quality of life, improve their relationships with family members, and help the person find meaning and purpose and dignity in the life that they have now. Family therapy with older adults and their loved ones, which is my favorite type of therapy, also helps to improve care and reduce burnout. So the next time you think that the person has dementia, there's not much you can do, rethink that and think about all of the possibility that exists. When I used to face a challenge in therapy, and sometimes even when I still face a challenge in therapy, I think this is going to make me a better therapist. And I was right. All of the challenges that I've experienced and continue to experience in therapy make me a better therapist. And I want this to be an invitation to you to join me in being a better therapist for older adults, because there is a lot that you can do for older adults without dementia who have depression, and also older adults with dementia who have depression. I'm Dr. Regina Koepp, and this is your weekly mental health and aging tip. I'll see you next time.